Hello, my name is Kendra Patton Silverman, and I am the Director of Clerkship Education at the Stanford Master of Science in Physician Assistant Studies program. One of the main components of my role is to place our third-year students into clinical rotations, and we're excited to send our students to LPCH to work with your teams. In this video, I will provide you all with background information about our students and program, the structure of our clerkship rotations, expectations of the students, information on your role as preceptors, and tips on how to incorporate students into your workflow. First, let's discuss an overview of our program. The MSPA program is 30 months long, divided into the pre-clerkship phase during the first 18 months and the clerkship phase during the final 12 months of the program. As clinical preceptors, you will host students during the clerkship year and help prepare them to work with pediatric populations. All students who are placed with LPCH teams have expressed a strong interest in working with the pediatric population, and many hope to work within the Stanford and Packard communities upon graduation. Each class consists of 27 to 28 students, and they have a diverse range of educational and clinical experiences. Upon acceptance into the MSPA program, all students have at least a bachelor's degree and patient care experiences. Some examples of their patient care experiences include registered dietitians, EMTs, surgical technicians, medical assistants, medical scribes, paramedics, Army combat medics, and clinical researchers with publications in major medical journals. We've even had a few NCAA athletes, a student that has qualified and competed in Olympic trials, and a former Major League Baseball player. We're extremely proud of our students, and we know they will work hard on your teams. Next, I would like to discuss student expectations and your role as preceptors. We hold our students to high professionalism standards at all times. Of course, they should be on time, respectful, ready and eager to learn, and they should be accessible to you. Please feel free to contact the students directly via email or on their phones. Any absences need to be cleared by the clerkship team first, and we will let you all know about the absences. As APP preceptors, you all serve an incredibly important role in medical training. We expect our students to work alongside the preceptors during their scheduled shift and to discuss goals with their preceptors. I have provided a copy of the general goals and objectives for the clerkships. However, I encourage you to discuss individual goals with the students early on in their training. For example, some students are interested in more practice with conducting a focused physical exam. Others are more interested in oral presentations or SOAP notes. And some students will like to participate in procedures and hone in on their technical skills. Regardless of their individual goals, we always encourage the students to be helpful on your teams. We want them to observe how APPs operate on the teams and to try and learn from everyone, not just their assigned preceptors and attendings. They can also learn from the technicians, nursing staff, medical assistants, other students, etc. During the final week of the rotation, you will receive a link to complete the preceptor evaluation form. This form is intended to provide us with information on how the student performed and addresses areas such as patient care, clinical knowledge, responsiveness to feedback, professionalism, and communication skills. You will be able to leave both student-facing comments and confidential comments that only the clerkship team will access. The students will submit an evaluation for their preceptors as well on topics such as methods of feedback, teaching style, and their overall experience. Now that I've gone over information on the preceptor and student expectations, let's shift gears and discuss ways on how to be a successful preceptor. My top 3 tips on how to be an excellent preceptor include giving students regular feedback, providing students with more autonomy as you gain trust, and time management for you. Let's discuss in a bit more detail. One of the most important aspects of clinical training is preceptor feedback. We encourage feedback if the student is doing well, and of course, if there are areas that they need to improve upon. There's an art to providing feedback, so I encourage you to create a style that works for you. Some preceptors provide feedback after every patient, some at the end of the day, or others with a scheduled time that works for you. We expect our students to apply the feedback, of course, and work on improving their skills on a regular basis. I have a few short handouts that I can share with your teams on different methods of providing feedback. My second tip to be successful as a preceptor is allowing the students to gain more autonomy as you start to trust them. The first few days should be dedicated to orienting the students to your team, setting goals, and establishing a workflow. And whenever you feel comfortable, I strongly encourage you to push the students to gain more autonomy. This includes learning opportunities such as obtaining a history, performing a physical exam, note writing, and participating in procedures with your oversight. The third tip I have for you to be a successful preceptor is to focus on your time management. We don't want you to fall too far behind due to having students on your team, and we want the teaching experience to increase your joy of practice and not add additional stress. Time management is especially crucial during the first few days with a new student, and also students who are new to clinical training. Staying on time can be accomplished in several different ways. Some providers give students a specific amount of time with each patient, and when that time has expired, they will join the encounter for a bedside presentation. Some providers will assign the students a lower number of patients per day so the students can take a deeper dive with those patients and focus on quality and not quantity of patients until they establish a rapport with the team and get the hang of the workflow. Some preceptors will serve as the scribe for the students in real time or have the students scribe for them. This can also be helpful in teaching your students how to structure and write a SOAP note in addition to saving time. It is completely up to you all as preceptors to decide how you will structure your workflow. In addition to the short handouts I have to provide feedback, I also have handouts on how you can incorporate students into your workflow. So please reach out to me if you would like more resources and tips. The last topic I would like to address is student behavior issues. It is rare that you'll have issues with our students. However, there are a few ways to address them if they arise. For minor issues, please feel free to address it directly with the student as it happens. And any larger issues should be reported to me as soon as possible, such as unexcused absences, chronic tardiness, or other professionalism issues. There's an area on the student evaluations to leave confidential comments, but for the larger issues, we would like to know about those before the end of the clerkship. You can always contact me if you have issues, questions, concerns about our students. I'm happy to help and I'm here to support you all. Thank you all for taking the time to watch this video and to host our students. Our students are truly appreciative of learning from APP role models and mentors. We appreciate your commitment to PA education, and we look forward to working with your teams. Thank you.
Hi, my name is Bridget Gramkowski. I'm a pediatric nurse practitioner and UCSF School of Nursing Assistant Clinical Professor in the Pediatric Nurse Practitioner Primary Care Program. My clinical practice is at San Francisco General in pediatric neurology, and I've been managing our clinical residency placements at UCSF for several years now. My first and foremost, I would like to say to you all, thank you. Thank you very much for your amazing teaching. We rely on you. We grow with you. We thrive with you. We really, really value your work and your teaching. And our students have amazing clinical and personal vignettes of the clinical care that you give to your patients. And we thank you for sharing your time, your family, your clinical families, and your patients with our students. I've been asked to give an overview of a couple of different areas for you. The first is what our program is like. So our cohorts are usually between 9 and 16 students in primary care. Our length of program is about 2 years. We start in September of the first year and we go through until June of the second year. Our clinical rotations can be as short as 3 months, which is about a quarter, which is what our UCSF system is based on, is academic quarters. However, we try to place students for at least 2 quarters or roughly 6 months. And some sites preceptors prefer, and students have had great success in year-long clinical placements. So that really is a little bit site dependent and preceptor dependent. Our student backgrounds come from 2 different categories. We have students who are master's entry nurse practitioner students, so they have changed careers and become nurses very recently. And but they have a professional background in another area of expertise. So, for example, they might be a teacher or a respiratory therapist or a behavioral interventionist. So they come with some other professional experience that informs their clinical care very beautifully. The other group of students we have is, of course, experienced nurses, and they will share with you their background of whatever setting they've been working in, whether it's a hospital-based setting or a community-based setting, and they're here to transition into an advanced practice role. So, and then within the program itself, of course, we have a range of experiences from our first year students who are starting out in their advanced practice learning all the way through to our second year final winter and spring quarter students who are really advanced and making that transition out into their clinical practice. Our students will always introduce themselves in detail to you in their first introductory email. So they'll give you not only their previous work experience, but also their clinical training in the program. So you have a strong understanding of their knowledge. Here at UCSF, we've divided the curriculum into year 1 and year 2. And in year 1, we focus primarily on primary care essentials. So that's history and physical exam, child care, including assessment and planning around that routine care, and foundations for clinical reasoning. And this time period, if you're working with a student in the first year of the program, we would expect some very closely supervised preceptor experience, a lot of preceptor guidance and support, and kind of very focal skill building. So working on elements of physical exam, working on elements of history, and then pulling it together by the end of that first year. In year 2, we shift to more complex primary care and head into specialty care. And this is where we see more complex clinical reasoning happening with our students. They're able to create and formulate assessment and plan for a variety of patients. They're really eager to have interdisciplinary collaboration at this point, and you'll see them growing in their autonomy, still under your supervision. The role of the preceptor that we really, really appreciate here at UCSF is first and foremost facilitating the clinical experience and evaluating students accurately in your setting. And this varies based on the student level and demonstrated competency. So we trust and look forward to your assessment of the student in your setting. One of the topics that was suggested that I talk about a little bit was coordination of time. And of course, that's something we all struggle with. And what I would say is that this really varies with clinical setting and scheduling. So please do make this work for you. So in some settings where they have a really high volume of patients, they will have the students do a portion of the visit. For example, they'll do the physical exam while the clinician is taking down the history, or vice versa. They may have the student mirror their physical exam so that they can double check the findings. Or on a very busy day, you may just point out the abnormal findings to a student and have them be more of an observational role. You may find as the students are into their second year of the program that they have a lot more autonomy. They can go in and do the full visit, come out and present to you, and then you can double check their findings with the final wrap up with the patient. So it really is a very fluid process, and we always appreciate hearing from you about what's working well for you in your particular clinic. Educational resources, we really appreciate anything that you share with our students. You guys are frontline. You have the best resources for your patient population, both in terms of clinical resources and also community resources. And that is a foundational element to our students' learning. And we really appreciate you sharing any and all recommended resources with our students. As far as what we can provide to you, I have a series of references at the end of this presentation and resources for growing your clinical skills that we can offer. And also we're here to just support you individually in this work that you're doing with our students. But we really do appreciate you giving our students expectations about anything that you want them to bring to clinic in terms of references or resources or tools or clipboard, whatever you want to see your student bringing, please feel free to instruct them. And then growth-oriented opportunities. So we encourage you to assign patients for pre-charting for our students who have EMR access, and encourage participation in presentation and skills as your setting allows. And as far as you as a fellow colleague and a nurse practitioner, if you are interested in becoming a volunteer faculty member here at UCSF, I happen to be the chair of the committee, and I really look forward to you applying if you have interest in this role. We do ask that you have at least 60 hours, commit to at least 60 hours of volunteering per year with our students, which if you precept 1 to 2 quarters a year, that covers that commitment. We also really welcome participation in lectures, seminars. We have a lot of different volunteer opportunities for our volunteer faculty, and so we would welcome you into our UCSF faculty community if that's something that interests you. We do those applications twice a year, once in the spring and once in the fall, and so keep an eye out. Carrie will send out an email when we are opening up those application cycles. And again, you can let us know if you have any questions about that. Getting back to our students and how we assess them, we have a more broad set of learner and professionalism expectations that we ask all of our students to follow every quarter with every encounter in every setting. And these we call mandatory learner expectations. And then the second subset of expectations are more professional behaviors that we expect to see our students to demonstrate. So for mandatory learner expectations, we expect that they admit that they are honest about any mistakes or omissions that they make, that they incorporate your feedback into their practice, which I tell my students, the first time your preceptor tells you something, they're teaching you something. The second time they teach you something, they're reminding you. And if they've had to say the same thing the third time, that's now your job. And that is a learner expectation that by the third time, you are incorporating that into your practice. There really should not be a third time. And then again, we ask our students to identify strengths and deficiencies and limits of their knowledge. So if they don't know, they should be saying so. If they couldn't find something, if they couldn't see something, they didn't understand something, they should be honest with you about that. And then professional behavior, and this is a broad category of expectations, but certainly we expect appearance, reliability, punctuality, excellent communication in regards to any changes in schedule, all of that we expect to be absolutely seamless, and we'd like to hear from you if it isn't. And then finally, we expect our students to be really positive parts of your clinical setting. So we expect really positive and respectful communication with everyone in your clinic. And again, if you have any concerns, please reach out to us. We will give you an evaluation tool at the end of each quarter to rate our students. And this is just a summary of the different areas that we're assessing. And I'd like you to just know that these are progressive, meaning they change each quarter. So the demands or the expectations of the growth change as they progress through the program. And these are based on AAP and NOMS guidelines. So these are evidence-based evaluation tools. And the most important part about these tools is that you're giving us your honest assessment of what you're seeing in clinic. And if you have any concerns at any point, please reach out to us. We're here to support your teaching, and we have a lot of interventions and things that we can do that often work very, very quickly to improve student outcomes. So please let us know if you ever have any worries. And I also want to just reinforce that you as a volunteer in our professional community, you are teaching our student and you are giving us an honest report of our student, but we are the ones as faculty, we are the ones doing the grading and the assessment in terms of trajectory and mastery in the program at what level. So please don't feel like you are responsible for any kind of grade. That is absolutely the faculty's role. We will be emailing you an introductory email before the quarter starts to introduce you to the student. We email you mid-quarter to just check in and ask how things are going. The student will also check in with you mid-quarter with an informal copy of the final evaluation so that they can see how they're progressing in all the areas they'll be evaluated on at the end of the quarter. And then you'll get an automated link to our official evaluation in about week 9 of the quarter. Anytime you have any questions or concerns, please reach out to us. You'll have our email, you'll have the student's email. You also have our phone number that we put in our introductory letter. And so we're really happy to support you at any time if you notice anything. And then finally, I was asked to talk about what are my 3 top tips for being a best preceptor. And I would say giving clear expectations around anything that you're doing in clinic. And certainly assigning pre-clinic homework so that the students are coming prepared to clinic and are able to work with you in a harmonious fashion throughout your clinic day. Use the tools that we are giving you, these evaluation tools that we're giving you, to shape your feedback. And if you're feeling uncomfortable about anything you're experiencing, please again, come to us. And then lastly, be yourself. These students will remember you forever. You are an incredibly powerful and positive shaping force in their education. And we really recognize the importance and the long-standing effect that your positive work and teaching has on our students, on their clinical practice going forward into the real world. So thank you for all that you're doing. Again, for your amazing dedication and work with our students. Please reach out anytime you have any questions or if I can support you in any way. Thank you again. The whole UCSF School of Nursing thanks you, and in particular, the Pediatric Nurse Practitioner Primary Care Program thanks you.
So really briefly, I'm going to address the topics given to me. First, let's talk about our program. We have 33 students now in our youngest class. We're going to max out between 35 and 40 students. We don't plan to have more than that. We just don't have the space. It's a 28-month program, 16 months of didactic and 12 months of clinical. The length of our rotations, they have 9 of those. They're 5 weeks long in most cases. The student's background is usually pretty good. It does vary. Some have been emergency room scribes or MAs for a long time. Some have just done an adequate amount of shadowing. Occasionally get someone who's been a nurse. And by and large, they have a undergraduate grade point of 3.0 or above, usually quite a bit above from a reputable school. The role of the preceptor, the first thing is just getting, helping us do the onboarding, especially if it's a new site or there's new admin personnel, getting the student approved and getting them a badge and access to the EHR, EMR is really important, and we need to know the lead time for that, whether it takes a week or a month. Then some type of orientation. It can be, and during the pandemic, it could be a phone call. It could be a day before they arrive where you meet them and show them around and introduce them, or it could just be done on the first day. Sometimes a preceptor does it, sometimes staff. As long as it gets done so they're not lost and they feel welcome and everyone knows who they are. Then if there's any preparation, some preceptors like them to review certain topics or do some reading on certain subjects before they get there. Maybe it'd be vaccinations, maybe it would be a procedure, so that's fine. Don't ask them too much. They are pretty busy, don't overload them, but absolutely if it's something they need to kind of brush up on, maybe scrubbing in or something like that, in the initial email, or we can put it in our software that they should do that if it's something that's going to take place every time. It helps to have a schedule for these, especially if multiple preceptors are involved. It really helps the student not feel lost, knowing where they are supposed to be on a certain day, letting that preceptor know that they're going to have a student that day. All those things really help smooth things out. Just can be a simple calendar you print off the internet and write in the preceptor's name and the student, post it, that sort of thing. It's great if the preceptor takes enough interest that they assign a little homework, maybe have the student give a presentation to a meeting, or really just involve them in whatever the day-to-day, week-to-week rhythm of the clinic or hospital is. If there's meetings that it's appropriate for them to attend, or CME or anything else going on, they really like that, feeling part of the team. But again, don't necessarily overload them. They are studying for their unit tests, and sometimes they have a lot of miles to commute. But they seem to like it when they do one presentation or something like Grand Rounds. It's very popular with the student. It's really important that our students are professional. We want any feedback we can get on lack of professionalism. That's speech, demeanor, decorum, dress, anything to do with how they approach medicine. Very, very important to us, and we have methodologies to improve that in the rare case where more needs to be done for professionalism. When there is a student who's lacking in a skill or clinical acumen, generally we hear about it, we act quite quickly on it, usually that day, and we will talk to the student, have a meeting with them, and see if we can correct that easily. It's usually a misunderstanding. In the rare case, we'll stop the rotation, cancel it. The student will have to make it up. A lot of times it's just not a good fit. Call it a personality conflict, call it expectations. It varies. And then we'll have the student do some specific exercises to improve whatever problem it is before they go back in the clinics. Occasionally they could go back in the same clinic after taking a week or a couple days off to brush up on things, but oftentimes we just start over and make sure they have time to tune up whatever's lacking, which is very rare again. And we'll finish up here with 3 tips on how to be the best preceptor. I could say more, but first things that come to mind is take the time to do an orientation, an introduction, an overview. That really helps relieve anxiety, smooth things up, keep students from getting lost. Sort of take them through your day-to-day, week-to-week activities, and again, introduce them to everyone. Take time to explain cases and procedures. Students really like it when they're learning, when more technical things or more unusual things are explained to them. Even if they know quite a bit about it, they'll usually glean something from a good, concise explanation. Also, do what you can to provide autonomy for our students. They do vary in aptitude. Different practices are more comfortable with providing autonomy. But 2 suggestions there. One is to maybe set aside the last week for the student to see some patients on their own, and maybe write a note on their own from start to finish, or find out or identify a part of the examination process that you're comfortable the student doing on their own. For example, taking a history or doing the physical exam or doing certain procedures, and set those aside for them. Well, that's all I have for you. It's a pleasure. We really appreciate those of you at Stanford who are helping our students. It's been a great success, the placements we've had so far, and really appreciate it and look forward to working with you in the future.
Hello, everyone. I'm Patty Stein, the clinical coordinator at Sonoma State University Family Nurse Practitioner Program. I'm a nurse practitioner in clinical practice in Northern California, and I'm also a program graduate. Our program is located here at Sonoma State University in Rohnert Park, California, and we're part of the CSU, California State University College System. Our program accepts about 40 students each semester for our full-time track and about 40 students for our part-time track. Our program runs on a traditional academic calendar, so our students start in August, late August, and they end in December, and then start again in the spring and end in May. Our students also have the option of taking summer semester and winter session to meet all of their clinical requirements. Our rotations must be completed in an outpatient setting, and that includes the emergency department. Our culturally diverse students are chosen from a pool of applicants that have at least a minimum of 2 years of hands-on nursing experience. We value that here at Sonoma State, and we want students who already know how to take care of patients from a hands-on or bedside nursing perspective. Our students are well vetted before they are accepted into our program. Our goal is to train clinically competent and culturally diverse nurse practitioners who are highly qualified to enter the workforce as a nurse practitioner. After completion of advanced physical assessment, our students are ready to start their first clinical rotation. For the full-time cohort, this means that they start in October 1st and they're done by mid-December. This is kind of their first time to be in an outpatient clinical setting, to see their preceptor interact with patients, how they go about a visit, how the office works, and really kind of what that outpatient rotation looks like. This rotation takes about 80 hours for them to complete. Our part-time cohort, they do their first clinical rotation over an entire semester after they complete advanced physical assessment as well. In the subsequent 3 semesters, that would be nursing A, B, and C, students are required to complete 192 hours each semester of hands-on clinical experience. And this comes out to about 150 hours in the clinic with you. Those other 42 hours come from other hands-on experiences through the program. Our students can rotate with nurse practitioners, certified nurse midwives, MDs, DOs, and PAs. Our students must also complete an OB rotation. There's no set number of hours. We actually prefer that they have clinical contacts. And so we require them to see at least 40 OB patients performing at least 50% of the visit. So that'll be 10, we prefer about 10 first trimester, 10 second, 10 third, and 10 postpartum. And we also require that they do 10 pelvic exams. Now, some of those requirements can be met in the primary care or internal medicine setting. For example, in primary care, if a lady comes in for a UTI and is pregnant and she's in her first trimester, of course, they can count that contact because they would be addressing her pregnancy in that visit as well. Again, this OB rotation takes most of our students about 80 hours to complete. Our students are also required to complete a pediatric rotation. There's no set number of hours. Again, we want them to actually do more than 50% of the visit, but it takes students about 80 hours. And they're required to see 60 pediatric patients across the age span of birth to early teen or mid-teen years. Clinical preceptors are required to complete a short 2-page checkbox type evaluation form each semester, and our clinical faculty will be very engaged with the student during the semester, tracking their office visits through a clinical platform called Typhon to make sure that they are seeing a wide breadth of students. And if there are any issues at all, our faculty is available to you at all times. We have a high level of expectation of our students. Our students and faculty are very appreciative of your time and your effort to give back to the next generation of clinicians. Our students will be on time, they will be respectful, they will be passionate, and they will be prepared to learn. They are expected to look up medications or medical terms or disease processes that they come across during their clinical rotation, and they will be prepared to discuss it with you at their next time. If a student is not meeting your expectations as a clinical preceptor, they will be given one chance to correct this, and if they don't, they will be removed from the clinical site. First, as a fellow clinical preceptor and clinician, I want to thank you for your time and dedication that you put into training clinically competent students. I know it takes a lot of time and it takes a lot of effort, and we understand that and we appreciate that. We are happy to provide CME to any of our nursing preceptors and a letter of documentation for any of the non-nursing preceptors to submit to their licensing board for relicensure. We look forward to working with you to train passionate clinicians who have expertise and are well prepared as family nurse practitioners. Thank you for your time and your consideration. If you have any questions, don't hesitate to reach out to me. My cell number is area code 530-636-0679. And my email is Stein, STEINP @sonoma.edu. Thanks so much and have a great day.